Hello everyone, today I'm going to be talking about carbidopa, also known by its trade name Lodocin, and how it plays a key role in the treatment of Parkinson's disease. We also look at some of the research techniques used to be understand how carbidopa works, including the X-ray crystallography and molecular visualization with the software Chimera. Let's start with a quick overview of Parkinson's disease. It's a neurodegenerative disorder, and one of the main issues is low dopamine levels in the brain. Dopamine is an essential for smooth movement. So, without enough of it, people with Parkinson experience tremors, rigidity, and slow movement. To help with this, patients are often given levodopa. Levodopa is a precursor to dopamine that can cross into the brain where it is converted to dopamine. However, there's a challenge. Much of the levodopa, levodopa convert to dopamine in the body before reaching the brain, without which reduce the effectiveness and cause side effects like nausea. This is where carbidopa becomes essential. Carbidopa's role is to inhibit an enzyme called DOPA, the carboxylase, or DDC, which convert levodopa to dopamine outside the brain. By blocking this enzyme in the body's peripheral tissue, carbidopa prevents levodopa from converting to dopamine too early, allowing, allowing more of it to reach the brain. When carbidopa is combined with levodopa, it leads to a greater dopamine availability in the brain, invo- improving symptoms of Parkinson and reducing side effects. This combination is a core part of Parkinson treatment. So, how exactly does carbidopa inhibit the enzyme DOPA decarboxylase? Carbidopa has a unique function group called hydrazine, which react with the enzyme cofactor PLP to form a stable linkage known as hydrazone. This stable linkage lock DDC into an inactive state, essentially turning off the enzyme in the body. By inactivating DDC, carbidopa reduces the dopamine produced outside the brain, allowing more levodopa to cross the blood-brain barrier and be converted where is needed. This mechanism of inhibition is a key enhancing levodopa's effects in Parkinson therapy. Now, let's take a look at how scientists have studied carbidopa's binding mechanism. In 2001, researchers used X-ray crystallography to visualize the binding of carbidopa to the PLP cofactor with the DDC enzyme. X-ray crystallography allows us to see molecules at the atomic level by analyzing X-ray diffraction patterns from crystallized proteins. This technique was used for visualizing exactly how carbidopa binds to DDC, revealing the detailed 3D structure of the carbidopa PLP complex. With this information, researchers could confirm how carbidopa inhibits DDC, which has been invaluable in optimizing Parkinson treatment. To see this binding instruction in action, we have some pictures in here from the Chimera, the molecular visualization tool. First, we enter the PDB code which is a structure ID for DDC with carbidopa bound. We can access the 3D structure of the enzyme and see carbidopa in an active site. In the active site, we can zoom in and see how carbidopa binds to the PLP, forming a stable hydrosome linkage. This hydrosome linkage is what locks the enzyme in an inactive state, ensuring the dopamine production is minimized outside the brain. This visualization in Chimera helps illustrate carbidopa inhibition mechanism more clearly. So, to summarize, carbidopa is a vital part of the Parkinson treatment because it prevents the premature breakdown of levodopa by inhibiting DDC outside the brain. The selective inhibition allows more levodopa to reach the brain, reducing the side effects and enhancing the therapeutic effects. Using tools like X-ray crystallization and kinema, we're being able to visualize carbidopa's exact binding mechanism, providing valuable insight for developing effective treatment for Parkinson's disease. Thank you.